Hello, my name is Dr. Edward Fruitman. I'm a board-certified psychiatrist, a medical director of Trifecta. At Trifecta, we specialize in the treatment of adult attention deficit disorder. Current topic is, what is the best attention deficit disorder medicine? A big topic. Let me just start by saying that there's not one size fits all attention deficit disorder medicine. There's simply not the best one out there. The question is, which one is the best for you? Because attention deficit disorder is more of a spectrum diagnosis. There's not a typical adult attention deficit disorder person, at least I haven't met one yet. And the question is not only where are you in life, but what exactly would you like to optimize in your life? Because there's not a specific medicine that works for all people, and there's not a specific medicine that works for people in every single life stage that they're in. And our experience with treating adult attention deficit disorder is that people do not require medicines all the time. People are not requiring medications continuously, and the dosage and the type of medicine chosen depends on where a person is in their life, what are their life tasks and ambitions, and exactly where do they see a functional deficit that needs to be corrected. Generally, looking at medications available, stimulants are first-line treatment and non-stimulants are not first-line treatments. But each individual patient should not care about what is first-line treatment and what is second-line treatment. There's only one treatment that they should be using, which is what is first line for them specifically. Broadly speaking, medications can be probably subtyped into three categories: long-acting stimulants, short-acting stimulants, and non-stimulant medication. A lot depends on what other conditions other than attention deficit disorder that the person is also having. A lot of times for symptoms of emotional dysregulation, especially in women, non-stimulant medications may be more effective. Frequently when people are undergoing a period of time of multiple stressors, a stronger dose of stimulants may be indicated. When looking at higher doses of stimulants, I do prefer to prescribe long-acting medicines because they allow for fewer side effects, a longer lasting effect, but also a smoother effect, because the peaks of stimulants can cause undesirable effects that actually interfere with life and interfere with productivity. Another important consideration is, what is your field of work? A lot of times, stimulants may interfere with creativity for some people and may interfere with spontaneity. I've had more than one patient who was counting professionally on spontaneous production. Let's say somebody who is a comedian performing what people find funny is that kind of a broken filter production. ADD actually works on that person's behalf. And if they're thinking in a linear way, same as everyone else in the audience, they're simply not funny. What's funny is that kind of a broken filter production where a person just thought of something and already said it, and other people are just thinking about it. And that is seen as funny. If you were to correct it, a person may just freeze on stage. A lot of times, people who are in a creative field may need to drop the stimulant for a few days when they are in a creative process. But of course, any creative process is still detail-oriented, right? It's not just coming up as a concept, but also seeing it to the finish. And that's where stimulant medications could be very, very effective. Really making sure that the project is finished, that the procrastination is cared for, and that the project is moving on schedule. But still, for coming up with a creative idea, A person may choose to be off stimulant. Non-stimulant medication, unfortunately, needs to be usually taken on a regular basis. So that is not an option. A lot of times if people taking a non-stimulant medication like Strattera, tamoxifen, or Quellbri, then a person probably should not be taking breaks because that makes medicine a lot less effective. People who are working very long days, as we frequently see in New York City with some very demanding like legal or finance jobs, or people in medical field who need to work long shifts, should be taking long-acting stimulants, because also having a predictable and constant social presence and social persona is important, right? You are the same at 8 o'clock in the morning as you were at 8 o'clock at night, and your coworkers may notice a difference. So longer acting medicines like Vyvanse or Strattera may be on order. People who work regular 9 to 5, but the work requires a certain intensity, may choose to have shorter acting stimulants. So there is a lot of variability, and a lot depends on what is it that you're taking your stimulants or non-stimulant medication for. And what is the functional purpose and functional improvement? Frequently, when people are at the level of their first promotion at a corporate job, where all of a sudden they are at an increased amount of stress, because now they're responsible for their work that they used to do, plus they're suffering from distractions by people reporting to them. Actually, that's a time where a lot of times that people with adult attention deficit disorder come to see us at the level of first promotion, because that's when all of a sudden all of their coping strategies are no longer functioning well, because people with ADD usually do not respond well to disrupting their thought process or just distractions in general, which always is required in managing other people. A lot of times around that time, medications are started or increased. A lot of times the level of second promotion, once a person actually is promoted to a level where they can delegate what they don't like to do and delegate what they normally procrastinate, and don't end up doing successfully or in a timely way. A lot of times the stimulant medications at that point can be either reduced or dropped altogether. People with ADD have ability to do quite well what they like to do. And there's usually not a problem with procrastination or focus on preferred activities. If you have someone you can delegate unwanted tasks, and if you have either secretaries or scheduling people who can schedule your meetings and your tasks, maybe the need for stimulant medication is dropped at that point altogether. Of course, another consideration is, are there any comorbid conditions? Is there anxiety, depression, emotional dysregulation? A lot of times, at that point, a person may need a non-stimulant medication that would be able to take care of those other symptoms. Like, for example, medications like Strattera and Quellbri are also antidepressants in their action. So a person who suffers from both anxiety, depression, ADD may respond well to one medicine, that is like, let's say, Strattera or Quellbri, or maybe even off-label medicine like Wellbutrin or some other norepinephrine acting antidepressant. So in summary, I don't think there is a one ADHD medicine that is best. There is not. It all depends on particular person's needs and the stage of life that they're at right now, and exactly where their functional deficit is that needs to be corrected. If you enjoyed this video, please like our channel and don't hesitate to write us with any comments or questions, because we'll take that into account when making the next video.